The station that speaks your mind. No filters, no fakes, just pure fire with top tier presenters. Hot FM at 20.
The heat is on. Welcome to Zambia's hottest radio talk show, The Hot Seat, exclusive to Hot FM 87.7.
Good morning and welcome to Tuesday's edition of your favorite talk show, The Hot Seat. I'm your host, Chisha Mwambe, and this morning we're featuring Bleesings, Phiri, who is a clinical officer general from Bauleni Urban Health Center, Lusaka Central Sub-District. Welcome to the Hot Seat.
Thank you for having me, and good morning, everyone.
All right, thank you so much for joining us. Now, we are also live on Kanele FM on 97.7 in Lundazi, also live on our Facebook page, that is Hot FM Zambia. So please go ahead and take a look and also leave a comment, and we might just, make it part of the show. So let's start our conversation.
Yeah.
This morning we're discussing Mpox. Now, for a layman, what is Mpox?
All right, thank you so much. So let's look at what Mpox was called first before we can actually refer to it as Mpox as it now. Mm-hmm. So Mpox, late in the 90s, 70s there, it was called monkeypox. This was changed because it brought a lot of stigmatization amongst the people that had Mpox. So Mpox is a viral infection that can be transmitted from human to human or animal to human, and it affects any human, regardless of the age, regardless of race. It affects Africans, it affects Americans, it affects Europeans, it affects the whole human race equally.
Mm. Why was it known as monkeypox to start with?
All right.
Why did they choose that name?
Well, okay. So in 1972, the first case of monkeypox was first seen in the apes and monkeys itself. This then was called monkeypox amongst those that were found. So as they discovered more and more on the information, it actually could spread from animal to human. Then we see the change from monkeypox to Mpox. So we first saw the cases of Mpox in the apes and monkeys. That is in 1972 and 1952.
Okay. Mm-hmm. All right. Now, how is Mpox spread?
All right. Thank you so much. That's a very important question. So Mpox is spread via human-to-human contact or animal-to-human. So when we talk about animal to human, so let's say if an individual actually gets to touch an animal that is infected with Mpox, whether be it a dog or a rabbit or any other animal that you can, or ingesting infected meat, which is having the Mpox virus, you can actually see the animal to human transmission. Mm. You can also see maybe an animal gets to bite you or a scratch from an animal, you can actually see the spread of monkeypox from an animal to human. Then let's talk about human-to-human contact. So human-to-human contact, we have the indirect and direct contact. So let's say if you're having direct contact with body fluid, let's say you touch somebody's sweat, any other body fluid of this human being, you can actually see a spread of Mpox from the infected individual to the non-infected individual. Then you also have the indirect route, which is, let's say that one exchanges clothes or sleeps within the same bedding with an infected individual. You see the spread of Mpox between the non-infected and the infected individual. Mm. And so basically this is how we see the spread of Mpox between human to human.
Can it be spread through sexual intercourse?
It's believed so that it can be spread through sexual intercourse, but it's not the only route to actually see the spread of Mpox. So we've seen more of this spread in people with multiple sexual partners and also those who are male to male. In other countries that you see male to male transmission, it's for those who are having the same-sex marriage.
Right. When the story on Mpox boomed, it was mentioned that it was more prevalent amongst people who are homosexuals, and the information that was out there was almost like it was exclusively to that type of people, but that's clearly not true, isn't it?
No, clearly it's not true. It's not the only. So it's just that when you look at the spread of an infection, you look at high risk groups. So we have certain high risk groups that are higher to receive or be infected with the condition. So when we looked at when the studies were shown, we obviously, when you look at the public health study, when they saw the study, they saw more cases being found with those who are homosexual, but it doesn't exclude the fact that other people can actually get mpox if they are in contact with an infected individual.
Right. So if I'm seated next to someone on a bus and they're sweating, is that the way I would get it? Or even just contact, our skin brushing against each other? Like how exactly is it there?
All right. So when you look at the spread, it's not just direct contact, but you just touch the individual. You have to ingest the infected droplets of this body fluid. So it has to find a route in which to enter the individual's body. So when we look at the skin is actually having a protective layer. So if the protective layer is intact, you will not see an entry of any mycobacterium, whether it's been a bacteria or a viral infection. As long as it's the layers of the skin are very intact, you won't see that spread. But the most common spread we see is either inhalation or ingestion of the infected droplets, or even through sexual intercourse.
So, for example, if someone sneezes and
then you inhale the droplets that they have sneezed, any respiratory fluid that comes out, infected fluid, that's the one that you would see the spread. It's a little bit different from the way COVID was, so it can be spread even through saliva. So
right, because I was going to ask, how does this differ from COVID?
Oh, yeah.
Right.
So for it can actually be spread through saliva. So saliva, it affects almost every body fluid. So when we look at COVID was only respiratory fluids. So only the fluid that comes out from sneezing, from coughing, or singing can actually be spread to have COVID. But for it saliva, sweat, tears, any sort of body fluid that you can actually relate to.
Right. Now, what are some of the symptoms of mpox?
All right, thank you so much. So, understanding mpox. So, mpox presents itself as a flu-like fever or a flu-like presentation. So, we have fever, a flu, a cough, fatigue. The individual can also have a headache. They can also experience easy fatigability and also a rash, which now develops after the flu-like symptoms have passed. After the incubation period, you find the flu-like symptoms, and maybe after 7 to 21 days, you find now the development of a rash that will come, maybe starting from the face, going generalized throughout the body. It may start out as a flat lesion, then starts to increase more like an abscess. Then you also find lymphadenopathy, which is the lymph nodes begin to swell. So we have lymph nodes in our body. So we usually see this maybe when you have a flu or a cold. You might find that in your armpits is just something that is swelling there. That's the lymph node. So now for mpox, you find them swelling even more than you see them in a flu-like symptom, and then they might be prolonged depending on the individual's immunity.
Okay. So how long is that incubation period? So
the incubation starts from 0 to about 21 days. So during that period, you find maybe the individual may not have any signs and symptoms, then starts to develop signs and symptoms, maybe just a cough, a flu, then you see a progression of skin lesions being developed.
So then how do you differentiate it from being just a common cold or cough or flu? Because we get these things all the time, but then how do you know that this might be mpox?
All right. So it's very difficult to actually differentiate in the first period of the infection. So the only time that you distinguish it is the development of the lesions. So a normal flu will not give you a lesion. A normal flu can give you a few lymph nodes that will swell, but the only way that we can actually differentiate the two from each other is when you actually go to visit a facility and they get to test the very lesion that you might have, the lymph nodes that might appear. You can actually get and aspirate whatever is there and test this fluid that you find in there and to see whether it is mpox or not. So most of the times we have that difficult time to actually differentiate between, is this a normal flu? Is this mpox? So the best way to actually define it is actually even just doing investigations and seeing which whether it's the common cold or not.
Are those lesions painful?
Yes, they are painful. So even as you look at, I think a few days ago I had a cold, and I just found one of my lymph nodes had swollen. Could it be mpox? But it was it's painful even for any other infection, but as for mpox, they're very painful depending on how sensitive the person is. So you'll find people that are hypersensitive in just even a small cut, they're very much in pain. So you find that these lesions are actually painful. We find that the individuals are in pain, and hence finding them complaining of more pain, fatigability, because of the pain that they are going through.
So you said you found a lymph node on yourself.
Yeah.
Are you okay?
I'm okay.
You got tested?
I got tested.
Okay. Fantastic. So what should someone do if they have symptoms?
All right. So when an individual has symptoms, the first thing that you need to do, go to your health facility, your nearby health facility. You don't need to go to UTH. Every health facility in Zambia is actually offering mpox testing and also offering healthcare service. So as you come to the health facility, you need to tell us how you're feeling and what is really wrong. The problem we find with our clients, with our patients, is that when they come to the hospital and they're having a condition that is stigmatized in the community, or that is a hot issue in the country at large, you find individuals trying to withhold information and divert the condition to another thing, and hence we're not giving them a proper health. So even as you're not well, tell us how you're feeling. We cannot guess how you're feeling unless you tell us how you feel. Or if you have lesions, please present them to the health facility or health personnel so that we can be able to actually provide the correct healthcare service.
Okay. Now, how long does mpox last?
All right. So mpox lasts for 2 to 4 weeks. So it also depends on the individual's immunity. So if their immunity is well enough to handle the viral infection, you find them recovering more and more faster than an individual with a poor immunity. So when we talk about immunity, so the immunity part plays a very big role in the point where that on the severity of the condition. So if an individual has a reduced immunity or an immunity that is not well functioning, we find that this individual actually goes through a severe form of infection, which I think we put in relation with which we saw people who were having COVID had let's say that they're having a pre-existing heart failure, and then when they had COVID, they had an exacerbated severe condition. So when the immunity is well, you find people recovering earlier, and within 2 to 4 weeks, they are recovered.
So treatment is based on what? Just on symptoms, or is there actual medicine to cure the virus?
All right, thank you so much. So there is no specific treatment that is put to mpox. It is supportive management that is given. So if an individual is presenting with a headache, we have to manage the headache, or if they're presenting with pain, we manage the pain. If they're presenting with fever, we actually manage the fever. But then we have antiretroviral medication that is given to individuals that are at higher risk of having complications. And this would help out in managing the condition of this individual. And then we find that on individuals that are actually vaccinated for mpox or the smallpox that we had at some point. We have received some of these vaccinations before, and I think people at high risk are starting to be receiving this revaccination again, boosting the vaccination that we already received. Reduces the severity of the condition rather than it managing the condition. So what we offer is supportive management to help individuals recover fast from the condition that they are facing, which is the mpox, and depending on how they present themselves, how they present with their body as immunity.
Okay, so the vaccine, you talked about a vaccine. So there's a vaccine available for mpox.
There is a vaccine, and the vaccine is, so when we look at mpox, I think in my definition, I think I omitted something. So mpox is related to smallpox. Okay. So the same vaccination that is available for smallpox is actually given for mpox. So it works in relation with the smallpox and mpox. So the vaccine can actually be given to. So the vaccine is mainly aimed to be given to individuals that are high risk of receiving complications or having a severe form of mpox.
Okay. So how is this vaccine administered?
So the vaccine, it is a blood-based, it's an injection-based, can I say? So I'm sure we can't really remember how we had so many. Maybe if we look at our mothers and how they used to take us to, we take us for under 5, we would actually receive so many injections. So we find most of these vaccinations, so the vaccine for mpox should be and is an injection form, which most people don't like injections.
Yeah, right. Yeah, very difficult sometimes to get that. Okay, so there's a vaccine. Is it just one type, or are there different types? What's there to know about these vaccines?
All right, so when we look at the vaccine, so as currently we only have one type. I'm sure as we are going forward, we will see many other types being developed as CDC begins their studies. So they have still been doing these studies. Yes, it started a long time, so now it's still trying to find a better way to do the vaccine and make it more available for more people. So right now we only have one type of vaccine, and which is the injection based. For some men are very difficult with injections. I've seen grown men cry.
Right. Right. So how do we access this vaccine?
So the vaccine is not yet made available in Zambia. So we're still waiting for the Ministry of Health to actually give it to purchase the vaccine and make it available in Zambia. So we have. So in the relation with the vaccine, we used to have one which has the same potency, and which some have already received during their under 5 injections, which most of us have gotten, most Zambians have gotten. So which we were getting for chickenpox. So it's the same with the smallpox vaccination. So revaccination is still being vaccination is still being purchased to actually bring out and redo the vaccination for higher risk individuals. Okay.
So what are the numbers looking like now in Zambia with mpox infections?
All right. So currently we had another infection reported in Zambia. So the numbers are really rising to an alarming state. So when last I checked, we had about 10. So we're still having increased. That was 10 for my facility. So we're still having a number increasing from the cases that we have already seen. So basically, we are having a raise in the numbers. So numbers keep on changing because of the diagnosis being given more and more in more cities in Zambia.
Can we expect more infections now that we're going to be going into a cold season?
Yes, we can expect more infections if individuals are not really protecting themselves, if we as the community are not really taking advantage of the services that we are being provided, or if we're not reporting the cases. So we're having less numbers being reported, and when we have a positive, meaning that the whole household is at risk. But if people are shying away from reporting such cases, we're having more and more cases. So we would expect more cases of this and more suspicion being raised due to the court season coming up. So even as we go through the court season, it's very important that we practice good hygiene, so which is hand washing and also the vampire sneeze or the elbow sneeze. As we are coughing, as we are sneezing, we try to protect the individuals who are around us who are not infected, whether we have a confirmed or non-confirmed mpox.
How do you think we're handling mpox? Are we doing the right thing right now? I mean, you go around, you don't find too many people talking about mpox, but it's very dangerous.
Well, I feel like we are not doing so much as a community, as much as the ministry is trying to do so much in sensitizing the community about mpox. We definitely have to take keen interest as a community to actually ensure that our schools, our children, our markets have proper hand washing basins, proper hand washing spots, so that we can reduce the number of flus, reduce the number of mpox spread. So I feel like we have taken it as that's by the way, there's mpox. Oh, by the way, mpox is there. We shouldn't wait for very alarming numbers to actually take an interest in trying to prevent mpox.
So should we be masking up like we did in COVID times?
Well,
should everyone be wearing a mask? Do you need to sanitize before you get into a building? What should we be doing right now?
All right.
Are we too relaxed with this?
Well, we're too relaxed. So we need to be actually having, like the way we had COVID, we should actually have those spots continuously. Even if we shouldn't wait for an epidemic to actually happen to ensure that we start practicing safe hand washing techniques, or even sanitizing, or even masking up as we have a flu, or masking up when somebody has a flu. I think it's something important to actually take in interest is we can wear a mask as let's say if we're infected of any flu or any suspected flu, we can mask up and protect the individuals surrounding us. Have hand sanitizer as you're coming in or going out in the building. As you're leaving, wash your hands. Even as you're handling surfaces, handling money is also something that we need to practice as sanitizing our hands and washing our hands.
Right.
Because we find that mpox survives a longer period of time than COVID on surfaces.
How much more?
It can stay for about several hours, even 7 hours difference, even like 21 hours difference. So we find on money, it depends on the moisture of the fluid. So consistent moisture being produced on the surfaces on money, you find you can actually find that the virus keep on surviving. So we really need to take more interest in hand washing and also sanitizing our hands, and also maybe masking up as one of the preventive measures.
Okay. If you just tuned in, this is the Hot Seat. Our guest is Bleesings Phiri, a clinical officer general from Bauleni Urban Health Center, Lusaka Central Sub-District. I just wanted to circle back to the vaccine. I remember during COVID, there was that conversation around how you could take the vaccine but still get infected. Is that the same situation with mpox?
Yes, it's the same situation. But this is a very important question and very important to understand about vaccinations. So vaccinations are not there to prevent completely the infection. So the vaccination actually helps you to have a fighting chance against an infection. So hence having that a reduced severity of the condition. So if you're vaccinated, you have a greater chance of coming out of the condition that you might have, whether it being COVID, whether it being mpox. You have a better chance of not having severe or complications that are related to mpox. So the vaccine helps you not to have severe forms of mpox.
So do you think members of the community, do they understand that aspect, or does that contribute to vaccine apathy?
Yeah, so the vaccine apathy, because of this misunderstanding, we have seen more apathy on vaccinations, and hence you find people shining away from the vaccine, not understanding to say the vaccine actually prevents severe forms of a condition rather than prevent the actual condition. So if on our part as health workers, we really need to sensitize the community more about how the vaccine actually works and the importance of this vaccination. Even as you're having a condition, you need to still trust your healthcare service and say, okay, even as I get the vaccination, it is to prevent severe forms of a condition, whether it be COVID, whether it be mpox.
Okay. So it must be a struggle to explain that.
Yeah, it is it's a big struggle, because you want them to understand, and then you can't expect everyone to understand it right there and then, but it's continuous education, continuous sensitization, and maybe meeting one-to-one with people who have questions like this, but it's not an easy thing.
What's that been like when you speak to people in the community? How do they perceive mpox? Are there any superstitions or any of that? Well,
superstitions are always there. So we find superstitions. It's actually my grandmother will bewitched.
Right. You hear all sorts of stories.
All sorts of stories. Maybe he stepped on something, or maybe you're cursed, but definitely it's something that we are still trying to continuously educate our communities and bring them to the understanding to say that there are conditions out there that can also be managed by healthcare means, and it's not a curse, or it's not you stepping on something that has caused the condition, so it can actually explain it scientifically and also manage it.
Mm-hmm. So how can we change that perception, because it seems to continue to persist?
Oh, yeah.
That mentality just stays with us. Same thing with COVID. When we had that, it was very difficult for healthcare providers to just do their jobs because of these perceptions that exist.
Okay. I think the very way we can, one of the ways that we can actually best tackle this cancer in the community is a cancer. So if it's bringing people away from receiving healthcare service, then it's a cancer. It's slowly killing them, or killing the community, because the community is not being involved in their condition. So one of the ways is actually community engagement. So when we talk about community engagement, it's actually engaging community leaders, community focal point people who can actually talk to their community. So when you eliminate the community from your sensitization, or eliminate the people that are actually found in the community, you find the community fighting against whatever you are actually trying to tell them or help them to recover from. So, but when you see maybe a chief getting involved and telling the community to actually seek healthcare service, you would see people actually come into the healthcare center and receive that healthcare service. And also engagement of other economic people that can be involved. So you're involved in the public health service, you're involved in the council, in trying to ensure that some of these things are being provided, like let's say, like the way the Minister of Health had distributed hand washing sports to many of the markets, we find that when we find these sports, we are actually encouraging individuals to actually wash hands. So if we have such engagements, we can see a change. But if the community is not engaged or not involved in having their own healthcare service, it's going to be difficult to actually do anything to help prevent many of these communicable diseases.
Okay. Now, can Mpox be managed at home? If I have it, can I just isolate and just treat my own symptoms if it's a headache or a cough? Is that recommended, or do I have to come into a healthcare facility?
All right. Thank you so much. Self-medication is a serious problem, and the best way to actually ensure that you're actually receiving proper management or proper care for yourself, it's actually coming to the facility and getting help that will be directed to whatever you are having. Maybe that moment when you're just self-medicating and then you ignore certain other conditions, this would bring a severe form of a disease. So the longer the longer the condition of the disease persists, it brings more complications, and complications are very difficult to actually handle, as most people come when they are at the most severe form of infection, and this becomes very difficult for healthcare service. We cannot perform miracles in maybe in a split second or help you recover in the shortest period of time when you have come with a serious complication. But if you have an illness, it's better to actually come to the facility and receive further guidance, as whatever is prescribed to you, this will best help you. It might not be 100%, but it has a percentage of helping the individual. So we've seen a lot of antibiotic resistance because people will think, oh no, maybe in COVID, because we are given azithromycin, maybe we can do the same thing with but hence maybe you find that azithromycin is already resistant to your body, and then you find getting reinfected and infection becoming more and more severe, and hence having more complications.
So how do you find out whether someone is their body is resisting a certain antibacterial medicine?
All right. So the way we find out that somebody is actually resistant to an antibacterial, so first of all, we might prescribe the same medication and then find that the condition is not changing. So when the condition is not changing, this is now a red flag to us saying, okay, maybe let's do a culture. So where we get the blood and then culture that blood, then ensure that that blood is run through an expert machine that will detect on what antibiotics they are actually resistant to. So when it comes to like maybe I'll give an example of TB. So as we are diagnosing the TB, we'll get the sputum and it will be run in an expert machine that will run and test also the resistance levels of the medication that we give for TB. So it will give us a direct code to say, okay, there's resistance in this and this drug. So we actually use either blood or any other samples that can help us actually define whether you are actually resistant to antibiotics.
And so that's why it's important to go to a healthcare facility, right?
Yes. It's very, very important, because the more you're resistant to the first line drugs, the more expensive your treatment will be. So the higher the expense, the worse the outcome, because we find most of these other medications are very, very expensive.
Right.
And most of our community don't have so much money to actually buy this sort of medication.
So that could be seen as a deterrent then for some people, right? They'll come to a healthcare facility and then the bill will just be too high, so just probably think, let me just treat it at home.
Yeah, true. It's one of the causes that people have actually shunned away from actually coming to the facility. They're giving me medication that is very expensive. And hence, because we were so careless about taking medication, we take medication unprescribed, and then you come and have such resistance. And we wouldn't want to have such resistance. Remember, resistance can actually be acquired.
Right.
So if resistance is acquired, it now becomes very difficult to actually handle many of the cases. So if you have 10 people that are resistant to an antibiotic, it's going to be a serious expense, because that 10 people can actually infect 100 people.
So when you say if it's been acquired, what does that mean exactly?
Okay, to be acquired, let's say you're infected with, let me give an example, with a cough, and this bacteria is resistant to amoxicillin, is resistant to the first line drugs. Then when you cough and I inhale the bacteria, I will have the same bacteria that you have carried.
That is resistant to those.
So I've acquired that resistance as well. So I have that bacteria that is being acquired to me that will cause resistance to penicillin, resistant to many of the antibiotics.
That's interesting. So are you experiencing a lot of cases where people visit healthcare facilities after the situation has become severe? Is that happening more often than not?
So we see some individuals coming in, 1 or 2 or 3, you'll find they've come in with complications. Let's say they had the mpox, and then the mpox actually invaded the eyes and having blindness now. So that blindness has now caused them, they've acquired a secondary blindness they were seeing before, but now they're unable to see. This has come as some of the complications that we have. We also have people coming in renal failure, people coming in organ failure. So this is happening more often than usual because of the stigma that goes around receiving such healthcare service. You find, mpox, maybe you're sick of a disease for monkeys. Then you find people actually shunning away from actually receiving this care, and hence having so many complications being seen.
Okay. Now, who's at risk of being infected by mpox? What are the
risk factors? Yeah. Okay. So this is very, very important. So the risk factors that we have, so we have children that are less than 8 years old, pregnant women, healthcare workers at high risk as well. Then we find people with compromised immunity. These are people with cancer, people living with HIV. We see more of these having been at risk of mpox, and multiple sexual partners as well. People having multiple sexual partners is also at a higher rate. They find it as one of the risk factors.
Okay. Tell us about contact tracing. How is that going? If you find somebody has mpox, how do you go about finding out who they've been in contact with?
All right. So contact tracing is being done, and the way we are doing the contact tracing. So the individual actually gives us the contacts that he has, the people that he's living with. So in contact tracing, we have the people directly in contact, which is the family. Let's say if this person is coming from a family of 5, so all the family of 5 have to be elicited and followed for contact tracing and see if they have signs and symptoms of mpox. Then you also have hotspot testing. So if an individual is in school and they had mpox, so the school becomes a hotspot of that condition. So we now we try to investigate the class as a first priority and see whether anyone having signs and symptoms of mpox or having a flu-like symptom, and then put them on constant observation so that they can be an early diagnosis and early treatment being given. So we actually following up individuals even in the community as they are elicited. We don't even ask them to come to the facility. We actually follow them in the community and see them from there and test them also.
Okay. Are there any challenges with testing? Do you have enough materials, testing kits, as they would say?
All right. The testing kits are very much enough. And in testing, we don't have a challenge. The biggest challenge is individuals actually coming through to actually receive this healthcare service. to actually get diagnosed and have them recover at a faster pace. So I think testing is not much of a difficult thing because we are having the test kits are there. We have lab personnel that are trained. We have clinical personnel that have been trained, and some who have already been trained to actually identify and actually aspirate or pick a sample of the skin lesion.
Okay. Well, that's quite interesting. I mean, remember when COVID was around, there was always a talk of testing kits. Is the availability a case of people not coming in numbers to come and test, or are you selecting who gets tested exactly? How's that working?
All right. So everyone is screened for Mpox. So like the way COVID was being done, we were screening for everyone for COVID. So if they had signs and symptoms, they would actually get tested within the facility. So I think there was a period of time when we had only one spot that was doing the testing, would collect the samples and then take them to UTH, and then we find out maybe 1 or 2 weeks, that's when the results are coming back. But now we have the test kits that are, samples are being collected and tests are being done, and we're given the test results within 24 hours. If it takes long, maybe 48 or 72 hours.
Okay. So
we actually have the test kits and they are available, and anyone who has a suspected skin lesion, we actually conducting tests on these individuals. So we screen them, and if they fit the criteria, we subject them to the test.
Okay. How is the test done exactly? Is it the same way as COVID?
Oh, no. It's absolutely different.
How is this one done?
All right. So you actually have to pick a sample from the skin lesion that they're having. So there will be a bit of cutting that will be involved. If you hate razors, we sincerely apologize. It's the test that we have. Right. So we actually pick a sample from the skin lesion. We do more like a biopsy test, which is more specific than using fluids or using the nasopharynx sample. So the skin lesion is actually much easier for us to actually get a proper diagnosis.
Okay. So you can only get tested if you have lesions.
You can only get, at this point, you can only get tested as you have lesions. But we may see different tests being brought about when as more tests are being done or more research is being done. We find the getting of the skin lesion might be overseen, and then having another test coming up. So we cannot say this is just the gold standard at this point. We can find an evolved test that can actually pick up maybe via blood test or even via nasopharynx.
Okay. All right. So what would you say are some of the challenges people might face in preventing Mpox?
I think some of the challenges that people would face is most individuals will be some of them. I'll put it in 2 ways. So I'll put it on the patient themselves. So the challenges that we see on this patient, maybe, or this client that is having Mpox, will be stigmatization from either from the family or the community itself. Quite rarely, but you also see maybe some stigmatization also coming from health workers.
Right.
But this will bring low more self-esteem in this individual, having less time now to prevent this infection. Then other thing would be that people would shun away from presenting that they have a skin lesion. Maybe if you see people wearing now long sleeves, maybe if they have a lesion on their hand, putting more on long sleeves and trying to avoid people actually showing or seeing them with the lesions, and hence we find a faster spread happening because human to human is the highest way of spreading a disease. So I find that if individuals are hiding or shining away from receiving actually healthcare service, you actually find them having a higher spread, and people cannot actually prevent. If people are more open to say, okay, I had this, let me notify the facility, so that people actually can prevent the condition. So if there is no more if there's no notifications, it is very difficult to actually have prevention services being offered in an area.
Okay. Just to circle back to the vaccines, because I'm really curious about them. Is there a duration of protection, or are you immune for life after you get a vaccine?
So, as vaccines, as we give vaccines, so we find that when we give a vaccine, let's give an example of the cholera vaccine. So if you're in a hotspot area, you'll find revaccination comes in to boost up the vaccination that we get. So if we look at the way we were getting the BCG, which is some of the scar we have on our hands, we find that we are vaccinated once and then vaccinated again and again. We find that some of the vaccinations have been repeated in a certain period of time. So it is just to strengthen the already given vaccination that you have. So a vaccination may have a time frame. So we find that maybe like the cholera vaccination, we have like one which lasts for one year, some which lasts from 1 to 3 years. So, but we find that if you're in a hotspot area, you're actually encouraged to actually get revaccinated so that you can have a better stance against the condition that is more prominent, or the infectious disease that is more dominant in that area.
Okay. All right. If you just tuned in, this is the hot seat. We have Bleesings Phiri, Clinical Officer General from Bauleni Urban Health Center, Lusaka Central Sub-District. Remember, we're also live on our Facebook page. That is Hot FM Zambia. Also live on Kanele FM on 97.7 in Lundazi. Very soon we'll be opening up the phone lines. Get ready to give us a call on 0974-870-877 to give us your question or contribution. Our topic today is Mpox and just everything surrounding it. So, Bleesings, I wanted to know, how has Mpox been managed in other countries? I mean, we just used to hear it in different places, and then finally it came to Zambia. But how has it been managed elsewhere? And is there a potential of an epidemic here that we could worry about?
Okay, thank you so much. So in other countries, we find that some of the border lines were being not really closed, but we had people being placed there to actually screen for Mpox. And I think this is something that we are trying to adopt as well, to have screening points on the border countries or border towns. So on the border towns, we actually need to have like screening posts that have been 24-hour service, screening individuals that are coming in from other countries that can have the potential Mpox presentation. Then we find that they were developing isolation spots, which where individuals were infected and they were placed in that recovery spot where they would be isolated. But looking at our country and our resources, we find that we are encouraging actually individuals after being diagnosed, if they're not in a severe form, they can have a room for themselves in the house, so that they are treated for that they are managed, or they are preventing spread of Mpox from individual to individual within the household. And this is something that we really need to try and develop in our country, to screen individuals coming in from other countries on the border towns.
All right. So do we have hotspots here in Zambia that have been mentioned?
Okay. So far, we haven't had so many cases coming from just one area. We find case from different area, but some of the potential hotspot areas are areas that are highly dense populated. So we have places like Kanyama that can find a high density population and a faster way of an infectious disease to actually spread. We have places like Bauleni, it's also densely populated. You find also infection can actually spread on a faster rate because of the densely populated areas. We have places like Chawama also, where we find also individuals are living very closely, densely populated, and then you find also spread of conditions can actually be seen more in those areas.
Okay.
But we can see more cases from other places as well that might not be densely populated, or maybe individuals that travel out from Zambia to do business in outside the country. We can actually see also spread from if they go to an infected area or infected country, in a hotspot country, you can actually see more spread of the infection coming from those individuals coming back to the country.
So the lesions that appear, which are like the sores all over all over your skin, when you recover, are you scarred after that, or does your skin just go back to normal after you recover from mpox?
All right. So that's a very important question. So I think earlier I mentioned to say that there are certain individuals that have sensitive skin. So you may see a total improvement from individuals that actually had lesions and completely have no scars. And then you may have one or two people who can have a few scars depending on how they treated those wounds. If, let's say, if your skin tone or the skin that you have is more prominent to have keloids, which are the sores that come about after being infected. Maybe, let's say, you wrongly popped the skin lesion and then infection goes there. Sometimes we have those keloids where we see maybe women that have pierced their ears and then they did not pierce them properly, they did not disinfect. You find those growths that are growing there because of the wrong piercing, or maybe wrong allowing infection to actually go into those wounds. So we find some individuals recovering completely and without a scar, and some individuals having some scars.
Okay. All right. And how are those lesions treated? Is there a cream that you apply, or you just wait for them to subside?
So they are very self-limiting. So they are only present when the infection is active. So as the infection reduces, you find the lesions start to fall off, and they start to reduce and then fall off and then peel off, and then your skin is actually starting to develop. Okay. So in that 2 to 4 weeks, you find some of the lesions beginning to subside, and then finding the crust coming out, and you find that actually healing starts going on.
So they're just filled with fluid or pus?
So sometimes they are filled with pus and fluid. So you find, so when you look at them, they look like pasture-like, as if it's an abscess. So as they begin to heal, that abscess actually, that pus-like looking, so that fluid actually comes out, the pus begins to dry up and then comes out. You can be popped out like the way we do with an abscess.
Okay. All right. Well, we're opening up the phone lines now. Give us a call on 0974-870-877. Give us a call, and you can give us your question or contribution to the conversation we're having today. We have Bleesings Phiri, Clinical Officer General from Bauleni Urban Health Center, Lusaka Central Sub-District. Feel free to give us a call now.
You're listening to the Hot Seat on Hot FM 87.7. It's time for you to call now and get involved. Call now and get involved.
Hello, good morning.
Hello, good morning.
Good morning. What's your name?
Patrick.
All right, Patrick, please go ahead. What's your question or contribution?
My question goes to Bleesings, Mr. Phiri.
Yes, sir.
What is really driving the continued transmission of mpox, and what could be the factors that are contributing to this long-term of resistance?
Sorry, what did you say your name is?
Patrick.
Patrick. All right, Patrick, thank you for your call.
Sure.
All right. We'll pick up some more calls, and then we'll allow Bleesings to respond. Feel free to call us now. 0974-870-877. Patrick having a question there about some of the factors that are leading when it comes to mpox. If you have a question or contribution, we'd love to hear it here. Hello, good morning.
Good morning.
Good morning.
I'm good. I'm Jimmy. Good morning, Mr. Bleesings.
Good morning. Thank you.
Well articulated. Actually, I'm coming within the vicinity. And I want to commend you because I think one of the Saturdays, your workers, they came to our church doing the same program as, MPOC.
Mm-hmm.
But I've got a lot of contesting on the vaccine.
Mm-hmm.
I think my question is going to be on terms of availability.
Mm-hmm.
Currently, you are very much aware about most of these vaccines, they are funded by USAID.
Mm-hmm. Mm-hmm.
And you know what is on the ground? These guys seem to be putting out. Are we not affected in that same vein? That is my bone of contention. Then the last question is, I think I'm getting worried.
Mm-hmm.
Why is diseases, each and every, after 2 years, we had, COVID. This time around, we have MCOP.
Mm-hmm.
Don't you think this could be an issue of, climate change? So how can we handle that? Thanks, I'm Jimmy here.
All right, Jimmy, thank you for your call.
Thanks.
Okay, has a few questions there. We'll take a note. Let's pick up another one, then we allow Blessings to respond. Hello, good morning.
Yes, good morning. How are you?
Doing well, thank you. How are you?
I'm okay.
What's your name?
You are talking to Comrade Morgan within USAC.
Go ahead.
Good morning, everybody, and listeners.
Good morning.
My point of view, my understanding over the same disease we are talking about, MPOC. Our country is a landlocked country.
Mm-hmm.
We need surveillance, security, screening all the borders. And this disease comes from outside. And those who are coming in, who are going out, must be screened. We need proper machinery. Because these other diseases, that's why there is Ebola in Congo, there is a COVID there. But those who are coming in, are we safe as a Zambian? Screening them. Because before spreading the disease in with our people who are safe in our country, you have machinery to do so. You are talking about contact, but many diseases, what I now understand, are coming from outside. We need to be safe, make sure that all the borders, nobody entering with foreign disease to come in our country. Thank you, my brother.
All right, thank you very much, Morgan. All right, we have Patrick, Jimmy, and Morgan there. Blessings, feel free to respond.
All right. Okay, so the first question was factors that affect influence in the continuous spread of mpox. So some of the factors that actually contribute into this is poor notification. So now if community or people are not notifying that they are actually having this condition, we actually find more spread being done. So if you're still in an infectious state, we see more of individuals getting infected because you are not coming to the facility, receiving the help, and helping us to actually trace these contacts that we need to trace that can actually also be potential carriers of this infection. And then we see more spread happening more and more often because of poor notification being done in communities, notifications being done in the country. So there are people that are actually infected. So if you're sick, if you're not well, come to the facility. We can best help you from there and see a break in the continuation on the spread of this condition.
Mm-hmm.
Also talking about the vaccination and
that came from Jimmy.
Yeah, and seeing that some of the funding being pulled out. So we still have many other developers of vaccination, and the ministry is still working on acquiring more vaccinations from other developers of the vaccine, and we will see individuals actually being vaccinated and availability of the vaccine being available. We might see a mass vaccination like the way we had for COVID, or we might see the first key population who are at higher risk of getting the infection being vaccinated, and see now a turn up going back to the general population. Mm-hmm.
Right.
Then
Morgan talked about the need for surveillance, questioning whether we have machinery to
actually
detect.
So machinery is available in Zambia to detect mpox. So the Ministry of Health has made sure that we have hospitals that are running these tests, not only coming to Lusaka and actually having each province having their own labs specialized to actually handle these tests being done. So actually we are having surveillance going on in the country, and individuals have been positioned in border countries, so the border towns rather, where screening is being done, and individuals have to be investigated for mpox before entering the country. They find temperatures being taken, people being asked questions, and also being screened for mpox, so that as they enter the country, they're actually healthy and not having any symptoms for mpox.
Okay. And with our borders being so porous, how does that work there? I mean, you might have the machinery, but if the borders are so porous, it's still a bit of a worry, isn't it?
It's still a bit of a worry. So more and more, as we are seeing, more and more health workers are being actually being employed. So as more health workers are being employed, we have to have a faster way of actually seeing people in the border. So if you're having 1,000 people coming through the border, it's a bit difficult if you just have 2 people actually doing the investigations and doing the screening there. So more people are being employed, more cadres are being placed in the border towns, so that we can actually have more people being diagnosed or more people being investigated.
Right.
So even facilities that are nearby. So the most important thing is that we as health workers must be on board with the ministry to try as much as possible to ensure that screening is being done in the facilities, because we have facilities that are near border towns. So if people are sneaking into the country and they come with a condition, let's report the case. It's not necessary that immigration will immediately check them out. We have to be as vigilant as possible for this condition and protect our cities and protect our communities, because we are there to protect our communities from infectious diseases.
Okay, if you have a question or contribution, feel free to give us a call on 0974-870-877. Our guest is Bleesings Phiri, Clinical Officer General from Bauleni Urban Health Center, Lusaka Central Sub-District, and our conversation is centered around mpox this morning. So give us a call. Hello, good morning.
Hello, Clem. How are you?
I'm well, thanks. How are you? Hello?
Yes, I'm fine, thank you. How are you?
Good, thanks. What's your name?
Ben?
All right, Ben, we have Bleesings here.
Yes, Brother Bleesings. How are you?
I'm all right, thank you. How are you, sir?
I'm fine. I kind of joined when you were explaining that at times the mpox doesn't present the skin disease, but it will present the COVID kind of symptoms. So if you go to a health facility, what do you go to test for? Do you go to test for mpox, or do you go to test for COVID?
All right, Ben.
And the second question is it just government facilities that are testing, or you can go to a private?
Okay, thanks for your call.
Thank you.
All right, there we go. Some very good questions there. Thank you so much, Ben. 0974-870-877. Call us now if you have a question or contribution to the conversation we're having this morning on the hot seat. We'd love to hear from you. Hello, good morning.
Good morning.
Good morning. Yes, sir. What's your name?
My name is Dr. Mwishi.
Sorry, if you have us on loudspeaker, kindly asking that you just use your mouthpiece, please.
My name is Dr. Mwishi, Center of Excellence Disease Control, UTH.
Dr. Mwishi.
Yes.
Please go ahead, sir.
Yes. I want to emphasize on what our clinical officers say. A lot of people, they are skipping the
when they entering the border. Some of them they would like to act like if they are very fast and they don't pass on the screening. So we are emphasizing to the public, general public, to go and screen themselves when they entering the border. And another thing is, I want to clarify about our brother from telling us that concerning the scars, keloids, we say, I'm just clarifying, so the keloid is coming from, it's a virus also. It's not depending on the infection, but it's a virus. So I want to emphasize that, no, for example, look at the problem of hepatitis B in the country. A lot of people doesn't go to the screening center. I don't know why, because we are emphasizing, if you see some sign of hepatitis B on you, just go to the nearest place just to screen yourself. I think this is my contribution.
Okay, thank you, Dr. Mushi.
Thank you.
All right, some clarifications here and there, and also just reiterating some of the things that have been said here. We appreciate that. 0974-870-877. Give us a call and give us your question or contribution. We're talking Mpox here on the hot seat with Bleesings Phiri, Clinical Officer General from Bauleni Urban Health Center, Lusaka Central Sub District. Let's pick up another call here. Hello, good morning.
Hello, good morning.
Morning, sir. How are you?
Fine. My name's Mr. B. Chibamba.
Mr. Chibamba.
Yes, yes.
Please go ahead, sir.
Yes, I want to ask what are the symptoms? I heard he said that even to the private parts, if you have to malash, are there other symptoms in my private parts apart from lash?
Okay, thank you for your call. Okay. Appreciate that. All right, so we've had Ben, Dr. Mushi, and also Chibamba that just called us there. Please give us your response.
All right, thank you so much. Thanks so much, Doc, for the clarification on the...
I'll just ask that you get close to the mic, please.
Thank you. Thank you so much for the clarification on the keloids part, and also for the additions that you added, Doc. So I'll answer some of the questions that were asked. So can we go and investigate Mpox at private facilities? I'm not really sure how much information or how well the private facilities are actually equipped to test for Mpox. I'm more aware of the government facilities, but I come from a government facility, and government facilities are offering investigation and also screening of Mpox. Do we go to test for COVID or do we go to test for Mpox? Was a question that was first asked. So when you go to the facility, the first symptoms that you have are flu-like symptoms that may be related to COVID, may be related to and a common cold. So as you have those symptoms, you can actually go to the facility and notify the facility that you're having those symptoms. So as we go further into the disease process, you might develop a skin lesion that may appear. It may start with the face and then goes further to other parts of the body. So those skin lesions are actually the lesions that we are trying to test for. That may start as a flat and then end up as a lymph node, a swollen lymph node, lymphadenopathy, and then we can actually test for Mpox. So basically, it's difficult to, like I earlier mentioned, it's difficult to actually distinguish the two while they are starting in the first disease process. So you do notify the facility. As a facility, you notify them. The facility to keep on following up to see if there are any skin lesions that you develop, or was it just COVID. So COVID will be tested even as much as you have been investigated for Mpox during that period. So if COVID is negative, so we'll continue following up on you so that we can actually define or diagnose the condition as you go further. So basically, that's the thing. Then there was a question about mpox on the genitals. Or so the first thing that we see is the lesion. So the lesion can actually affect any part of the body, and we can see the spread as it goes downward. You can have lesions on the male genitals, or maybe on the female genitals. So the best way to actually define or diagnose whether you're having mpox or not is actually come to the facility and know. I think there's not much information on whether you have discharge or no. So discharge may have come through maybe because of another condition. So mpox can actually exist with another condition, which can be either a sexually transmitted disease. So even as much as we are investigating you for mpox, if you are in an adult age, we actually investigate you for STIs as well, so that we can have a holistic type of approach in managing your condition, or defining where you had gotten the condition.
So, because mpox is a virus, does that mean that it's here to stay then?
Yeah, it can pre-exist. So as we've seen many of other conditions, we find that some of the conditions are eradicated at this point because of the practices that we engaged as the community, practices that we engaged as healthcare workers. We find that the condition has been reduced. So the aim is to reduce further infection of mpox. So you may find reinfection 1 or 2 in the country, but what we'd want is that the infection rate is reduced to 0. But that is only possible if we are all engaged in sensitizing, and we are engaged in preventing this condition.
Okay. We have a message here. It says, I think there's a lot of apathy in terms of vaccination because people feel that these vaccines interfere with the reproductive system, especially in women. So the 2 questions: kindly highlight the side effects of the vaccines, and at what age can the vaccines be administered?
Okay. So when we talk about the apathy that comes about with childbearing age, so this has been seen a lot, and we've actually seen this happening more often than usual in most communities. So some of the side effects that you can see in the vaccination, or while somebody gets a vaccine, we'll find that an individual may actually go through the whole disease process. Maybe they have a fever. I remember, like when we were getting the COVID, people would have complaints of saying, "Oh, I'm having fever, I'm having headaches," and all. You might pass through like the disease process, the first part of the disease process. So it's more like the vaccine is getting used to the body. So we'd find maybe pain on the site of the vaccination. Maybe some side effects we find, maybe an allergic reaction to this vaccination, to those who can be allergic to it, but not more often than usual. We find people being allergic to this, the vaccinations. So vaccinations are very safe, and they are very safe even to women who are childbearing age, and individuals that are still seeking to present their children to actually receive the vaccination. So the vaccination is aimed for high-risk groups. So with high-risk groups, we mentioned to say there are health workers, part of them. Children that are less than 8 are part of the high-risk group, and people with multiple sexual partners are also part of the high-risk group. So vaccination is aimed to everyone that is in need of this vaccination.
Okay. All right, give us a call, 0974-870-877. We're talking mpox with Bleesings Phiri, Clinical Officer General from Bauleni Urban Health Center, Lusaka Central Subdivision, or District rather. Give us a call. We'd love to hear what you have to say. Do you have a question or a contribution? Hello, good morning.
Good morning. How are you?
Well, thanks. How are you?
I'm okay. This is Bleesings. How are you?
Good. Thank you. How are you?
Okay. This is the president of the community.
Sorry, we're struggling to hear you clearly.
Can you hear me now?
Much better. You said your name is?
No, this is the president of the party.
Sorry, we did not get that.
I'm saying this is president of the party.
I think I'll advise that you try and call us back because we just can't hear you clearly. If you're calling us, make sure that we're not on loudspeaker. If you have your device connected to a Bluetooth device or just earphones, just plug them out and let's just use your mouthpiece so we can hear you clearly. 0974-870-877. Hello, good morning.
Hello, good morning.
Good morning. What's your name?
You can hear me now?
Slightly better. Your name?
Okay, this is the president of the party.
Okay, please go ahead. We'll try and catch what you're saying.
Okay. It's a question. I wanted to find out a woman who is having a child, if she is having the same virus, can the baby be infected?
Okay, thank you for your call. Yeah, I think that's a very important question.
Oh, yeah.
So if a pregnant woman catches mpox, does the baby get affected?
Okay, thank you so much. That's a very important question. Yes, as we've seen that we earlier defined to say that mpox can be spread through body fluid. So the baby is covered in fluid while in the mother's womb. So we can see infection spreading from mother to baby, and we need to try as much as possible to actually prevent this infection in more of our pregnant women and also from our breastfeeding women as well.
What are the effects on the baby if they were to catch?
So the baby would actually have the mpox as well. So it would have the skin lesions as well, or maybe pastorism. This is process of having the mpox, and also maybe on the aspect of also maybe losing the baby can be one of the other complications that this mother can have.
Okay. Well, then it's very, very important to prevent the mpox from getting to pregnant women. 0974-870-877. What is your question or contribution to our conversation this morning? We'd love to hear from you. Hello, good morning.
Hello, good morning to both of you there.
Good morning. What's your name?
Yes, my name is Charles. I wanted to find out. My son came home. I'm just trying to look at the symptoms that you're talking about. He had some small abscesses. I don't know, they look like abscesses, on his legs. So I was trying to wonder if he's got some sort of a flu. So I was trying to connect with the symptoms. So I don't know, maybe if you could go through the symptoms, or maybe we should take him for a test. But it's okay now. But I don't know how it sort of survives how long it survives in the body even after. He was given an injection, he told me, and some medicine. So I don't know, maybe if you could go back to that as well. I would appreciate it.
Charles, where are you from?
From within Lusaka.
Within Lusaka, okay.
Yes.
All right,
but he was in the boarding school, so in the eastern.
In the eastern province?
Oh, sorry, Lusaka, within Lusaka province.
Within Lusaka, okay.
Yes.
How old is he?
Right. He's 12.
12. Okay, thank you for your call.
Oh, thank you.
All right. Well, concerned parent there.
Okay. So, Mr. Charles, you can actually go to the facility, let the child be seen by medical personnel, and they'll do further tests if they are suspecting that it's mpox. Because I'm not seeing the patient actually right now, meaning that I'm not really sure if the lesions are actually related to mpox or not. But what is important is you need to take the child to a health facility just to get tested. Okay, so the signs and symptoms are, so the first presentation may, in the first period of the infection, you find that the child may have a flu, a cough, body hotness, which is the fever, body chills, and also maybe presentation of fatigability and headaches as well. Then later on develop a lesion that they may develop, and hence after the lesion you may also have lymph nodes actually developing. So those are some of the signs and symptoms. So you can actually take your child to the nearest facility and get the child tested so that you are more set on emotionally and know that actually the child doesn't have mpox, and continue the treatment that was being given.
What's the recovery rate of people that catch mpox? If I have it, what are my chances of surviving?
All right. So the chances of survival are dependent on the immunity of your body and the immunity of an individual, and the recovery rate is at 100% if the individual actually reports. The individual actually reports to the facility early to be diagnosed and managed of the condition and any other presentation. So in that it's a viral infection, it can cause inflammation. So we're trying to avoid more of these cases. More complication even when one has the mpox. So as you have the disease, come to the facility so that we can advise what medications and what treatment you can actually get and receive the best care and have a better outcome in recovery. So recovery is very much 100% if individuals actually come to the facility and get managed of the mpox.
Okay, so if I don't have any underlying condition or disease, then I have a very good chance of recovering.
Yeah.
Okay. Well, sounds good there. So if that, like with what Charles said, there he's worried, he's seen these signs, what's the first step to take? Is it isolation or just immediately taking the child to a health facility? What happens here?
Okay, the first step is come to the facility and get diagnosed. Because you can isolate somebody who doesn't need to be isolated. Maybe it's just another skin infection.
Right.
So it's better to actually be diagnosed and know what skin infection that the child has and what skin infection an individual has, so that you can know the next step after being diagnosed.
Right. Well, Bleesings, I'd like to thank you so much for joining us today.
Thank you so much for having me. It's been a pleasure.
Pleasure having you too. All right, we've had Bleesings Phiri, Clinical Officer General from Bauleni Urban Health Center, Lusaka Central District. We were talking mpox this morning, a comprehensive conversation around it. I hope you learned one or two things about mpox. So we've been live here on Hot 87.7, also on Kanele FM 97.7 in Lundazi, also live on our Facebook page, that is Hot FM Zambia. My name is Chisha Mwambe. I've been your host. Look out for Thursday's edition of The Hot Seat with my colleague Peter Zulu. Well, stay tuned to Hot 87.7. Coming up next is The Urban Vibe with Honey.
We're like your favorite series, but with better beats and no buffering. Hot FM at 20. Your daily dose of non-stop entertainment. The heat is definitely on.